The reason we are here is because safe motherhood is everyone's business. We have religious leaders here, we have top scientists here, we have champions here, we have community. So it's a huge community because it's everyone's business. It's not for mothers alone, it's not for political leaders alone. We envisage safe motherhood as a roof on a house, built on a foundation with pillars. And those foundations are enumerated. So they are basically 6 pillars. We have family planning, we have antenatal care, we have obstetric care, we have postnatal care, post-abortion care, and STD HIV care. But on the bottom, where the foundation where this house, the pillars are seated, there's equity for women, there's primary health care, and communication for behavior change. These sound like usual concepts because you are more familiar. You'll find this everywhere. It's more familiar. But when you need to understand the social perspective and the medical perspective to tally them together so that you have a broad understanding of safe motherhood. When we understand that, we are in the right place. It's a place for everyone. It's a place where we need all of us to commit. It's a place full of love. Now, the rest of that is about the journey we have moved together, how the world has journeyed, and how Uganda has journeyed in this area of safe motherhood. And something very special because of your collective efforts, the world in the last 3 years has had a 40% reduction in maternal mortality. That's unprecedented, and we need to clap for that. Whoever is involved for that. 40% maternal death reduction is unprecedented. We still have 1 woman dying every 2 minutes. I don't know how many minutes I've spent here, probably 10. 5 have died. Overall, 260,000. These are human beings. Whenever we are doing our maternal and perinatal death audits, I usually remind our health workers, and Uganda has done a lot of work in that. The people we are discussing are not with us, but they are someone's sister, someone's daughter, someone's wife, and someone's mother. So we do everything within our means, everything within our capacities to ensure that we end preventable maternal and newborn death. Africa has had a very long journey. I think we all know that we are behind the rest, but trying to run as fast as possible. So at one point in 1990, Professor Mireme must have been a teacher then, 1 in 19, for every 19 people, for every 19 mothers, 1 would die. That was very dangerous. We've moved that to 1 in 57. But the other developed countries, when you see Europe, 1 in 6,390, shows that the risk of dying is almost zero, almost not there. So we need to move this. We need to move this. So we've been part, Uganda and most African countries, we are part of the commitments, global commitments. One is the Sustainable Development Goals. What is interesting is Africa is among the 3 regions globally that has also made significant reduction in maternal mortality. And we shall be seeing how this spans out in the next. So this is trying to understand what is driving all this. There are high inequalities that exist among the regions in Africa, and you'll see out of the 4 high burden countries in the world, Africa is represented by 2, has number 1 and number 3 inequalities. Sub-Saharan Africa accounts for 70% of the global maternal death. Uganda, our leading number 1 cause of mothers dying is hemorrhage. Mothers bleed to death. It's a very unfortunate and uncomfortable situation to see mothers bleeding to death. High blood pressure in pregnancy. Malaria, HIV, and the others under the indirect causes, and the other related causes. This information is available. We have very good data now, can be accessed on our Ministry of Health website. We have annual reports. Next. Where you see the dark, sometimes dark green is a good color, but this is dark blue. So it's not a good color. The very dark ones, I think what you call navy blue, doing so badly. This is under 5 mortality of children under 5. This is an indicator where Uganda actually does well because of our child survival and thrival strategies, including immunization, which we must protect jealously. There are some politicians who are trying to deviate people from vaccinations, but vaccinations are part of the reason Uganda is light blue. Our child mortality ratio has reduced to 52% per 1,000, 52 per 1,000, which is fairly good, and we can do better. Next. Tetanus has reduced, we almost eliminated it. It has been so, it has gone down. In Uganda, if we find a case of tetanus, then we investigate it aggressively. The diarrhea has now reduced. I think you know that we have a vaccine to vaccinate against diarrhea. It's called rotavirus vaccine. Now, diarrhea has disappeared. I was in Mbale the other week. I found they have too much of the drugs for treating diarrhea. I said, where did diarrhea go? I said, that is our magic. We vaccinated children and diarrhea disappeared. Even cholera that was very prominent in the Kasese there disappeared after vaccination. So most of these things disappear after we introduce science. So this is a slide that's showing that what that has, but the top 3 causes of death remain prematurity, birth asphyxia. Prematurity, babies are born before their actual days, and this is a big problem in Uganda. 200,000 babies are born before, they call them before the real date, born at the age. And that's a big problem because they have so many complications, 200,000 per year. Birth asphyxia, difficulties in breathing, apologies for some of the hard language, you don't need to cram anything, asphyxia. Congenital anomalies, some birth disorders, because these days our population is feeding on so many things, and so many things are changing. Next. This is the emphasis on the global targets. That's a very popular circle. And in the middle it has number 3. Number 3 is one of the most prominent, most talked about SDGs. It's called good health and well-being. Friends, we are here because we are healthy and well. It is the single most gift that God has ever given you, and you must work intentionally to maintain it. The world has committed that we need to reduce maternal mortality to less than 70 per 100,000. And I'll show you shortly the picture where Uganda is. To 70 per 100,000. It's not a simple job. Even the 70 are human beings dying. So in Uganda, those who do some mathematics very quickly, we deliver around 1.6 million babies a year. So if we had saved 70 per 100,000, you can see the work we still have to do. Something must be done at a measurable level. What is the activity? So we are saying all pregnant women should be able to access antenatal care, should be able to access 90% of all pregnant women should be able to access at least 4 antenatal visits, 4. 90% of all pregnant women should deliver under the hands of a skilled birth attendant. Unfortunately, VC, TBA is not part of them. There should be after delivery services, 80% should access that, and availability of emergency care and equity, 80%, and the social determinants of health. When I mentioned that safe motherhood is everyone's business, we needed to see the chief administrative officers here, the LC5s here, the political leaders. The social determinants of health are not in health. Health is a product of inputs. So when you have a number of inputs contributed by the different sectors, for example, nutrition. If you have a pregnant woman who is not feeding well because agriculture has gone down, she'll be anemic and she'll have PPH. Any single drop of blood she loses, she goes into decomposition, and that's PPH. So you realize social determinants of health, education level, it's very easy to communicate and share information with a group that is literate than the group that's not literate. Sometimes it's the other way around, but social determinants of health are going to be our emphasis. Part of the progress that I'm going to show that Uganda has made is because we are having women getting more literate, we are having women being more enlightened about their health, being able to plan their reproductive lives perfectly well, not really having baby after the other, and being able to have some money and to do some of the basics for themselves. Next. One we had in Kamuli, the husband has gone, is a driver, he had gone on safari. there was no money at home, she could not move. And by the time she reached hospital, she only lasted 35 minutes. So such scenarios of delays at home and delays along the roads is very disturbing. Delay number 2 is delaying to reach at the hospital. Delay number 3 is this delay that is at facility level. My team and all the Safe Motherhood champions, we are working very strongly on delay number 3 because we think this is where we have the most impact. Delay number 3. For our religious leaders here, we can package this message very well for you to put in the delays. The other science is complicated. But these delays, delay number 1, delay number 2, is something that is everyone's business. Number 2, the road is broken. They are trying to repair a bridge. These are serious issues that really affect our people. Others are living in mountains. Others are living in islands. Those delays are really a big problem. So delay number 3 is government's role, really duty bearers. We are doing a lot on this, and that's why we are counting and our numbers are going down. Next, TBAs make mothers survive. They are not making them thrive. There are many mistakes. It is not good enough for a mother to survive. She gets this out of this complication, but she gets a permanent complication of infection of reproductive system. She gets infertility. So there's a bit of, it gets a fistula, so many of them. So it's not enough to survive. But it's also important that you thrive and you lead a very good life and transform. Our next strategic focus is to, from access and coverage to equitable with quality. Equitable coverage with quality. We have been saying, beautiful here, we need a health center, but now government, I think for most of you have realized that we are changing the perspective. We want quality care. We are no longer building these small health centers everywhere. Those of you who have seen our health facilities now, they really look like health facilities. So with more engagement, we want to see that there is care for people in the islands, care for people in the mountains, equitable coverage, that we are not only concentrating in Kampala. And you'd find that actually, if I presented more data, you'd find there is better health care outside Kampala. Mothers are surviving, more mothers are surviving outside Kampala. Kampala has the worst health indicators. Sorry to mention, the worst health indicators are in Kampala. The targets under UN is every woman, every newborn, everywhere is the new one. You'll orient yourself more. It's available on Google. It has very simple targets and very specific. For our Safe Motherhood champions, this is important for you. The SDG goals, whether we get there, we must fight as hard as possible to make sure that we are part of the high table come 2030. It will be a nice moment, the Most Reverend, to tell you that we've achieved the SDG targets since you are a very good champion of safe motherhood. Uganda is committed to investing in innovation and workforce. We are also committed to increase the coverage, but also do a lot of work in the social determinants of health.